Welcome back to the fifth module in dealing with HIV/AIDS in your new venture. In today's module, we're going to be looking at the implication of the HIV/AIDS pandemic, and here are the module outcomes that you're going to be looking at. Firstly, outline the needs of AIDS orphans with reference at a basic level of understanding to the burden of a large number of orphans on society and economy. Outline the effect of a population composed mainly of children and the aged on the economy and also the state at a basic level of understanding. And then discuss the need for medical care for people with HIV/AIDS, as well as the implications for employers and the state at a basic level of understanding. Know and understand the implications of HIV/AIDS pandemic. There's a difference between an epidemic and a pandemic that we need to take note of. Firstly, an epidemic is used to describe any increase in the number of people recorded to have a particular disease, whereas a pandemic is when more than 10% of the population is infected with the disease. In South Africa, those two terms are often used interchangeably, but strictly speaking, HIV is a pandemic in South Africa. The needs of AIDS orphans. The loss of a parent to AIDS can have a serious consequence for a child's access to basic necessities such as shelter, food, clothing, health, as well as education. The effect of the population composed mainly of children and the aged. At the end of the spectrum, we have the elderly people, whose death rate is now slower or lower than that of people half their age. Like the orphans, many elderly people do not work and are dependent either on their savings or on the support of the extended family for their livelihood. The loss of so many skilled workers can also lead to lower productivity in organizations, which then battle to stay competitive and generate profit to enable them to stay in business. This in turn leads to less tax available for government to actually apply for poverty or apply to the poverty alleviation. The need for medical care for people with HIV/AIDS. As the HIV prevalence rises, the strain placed on hospitals, healthcare workers, and medical aids is likely to increase. Providing antiretrovirus treatment to everyone who needs it requires more time and training that is currently available in most areas of South Africa. The effects of HIV/AIDS on the workforce and family income. The HIV/AIDS has a direct effect on the workplace as well as your family income. It is known that HIV mostly affects people in their years of economic productivity. The HIV/AIDS destroys human capital built up over years and weakens the capacity of workers to actually produce goods and services for the economy. Individuals who would otherwise provide a household with income are prevented from working, either because they are ill with AIDS themselves or because they are caring for another sick family member. The effect of HIV/AIDS for an organization. The effect of HIV/AIDS for an organization is very wide and often measures related to costs. The costs to the company are as follows: direct costs, such as cost to employee benefits, medical costs, and increased costs related to staff turnover, such as training and recruitment costs, as well as the cost of implementing an HIV/AIDS program. Indirect costs, such as costs incurred as a result of increased absenteeism, employee mobility, loss of productivity, as well as general decline in workplace morale, as well as possible workplace disruption. The implications of HIV/AIDS for a specific workplace. The impact on a particular workplace or team can be severe. You will find morale of the team dropping because so many co-workers, family, and friends are developing AIDS and are becoming sick or dying. Your sick team members will become less productive and will not be able to carry out more demanding physical jobs, which will place an added burden on those who are strong and healthy. The implication of HIV/AIDS on an industry subsector. As the HIV prevalence of the country rises, the strain placed on its hospitals is likely to increase. People with HIV-related diseases occupy more than half of all hospital beds. Government-refunded research in South Africa has suggested that on average, HIV-positive patients stay in hospital 4 times longer than any other patient. Hospitals are struggling to cope, especially in hospitals where there are often too few beds available. This shortage results in people being admitted only in the late stage of illness, reducing their chances of recovery. please complete class activity 5 in your workbook. Thank you.